Knee arthritis. Nowadays, unfortunately, knee pain and arthritis related problems have surfaced to a quite a lot extent. Especially with the advent of joint replacement surgery, nowadays, a lot of joint replacement surgeries and knee arthroplasties are going on almost in all parts of the world. Although, with the advent of arthroplasty, the misery of these patients have actually reduced, but the disease burdens with the new over the period of time has actually increased. And we will be briefly discussing the two major problems of the knee. One is the knee osteoarthritis and other is the knee rheumatoid arthritis. Although it's not necessarily the patient can have only these two. Patient may have post-traumatic arthritis. Patient may have other autoimmune disorders as well. For example, patient may be having SLE and having an arthritis with the knee joint. There may be a patient may have psoriasis instead of leading to psoriatic arthritis, or there may be certain infectious arthritis as well, especially STD related arthritis or gonococcal arthritis has to be ruled out as well. But usually these gonococcal or psoriatic arthritis and other autoimmune disorders are relatively rare. Major burden of the knee problems and knee arthritis is actually shared by osteoarthritis and rheumatoid arthritis. As you know, rheumatoid arthritis is an autoimmune disorder. It is a chronic inflammatory disorder of the knee joint, although it affects multiple other joints as well, and it's a systemic problem and usually can affect in joints of hands, especially the metacarpophalangeal joint, proximal interphalangeal joint, wrist joint, elbow. Even it can cause chronic spondylitis as well. And in the lower limb, it mainly affects the knee joint, although it can affect hip as well as ankle joint. And as far as the osteoarthritis is concerned, it's actually a chronic degenerative disorder with multiple risk factors, which are some of them are modifiable and some of them are non-modifiable as well. But on the whole, it is actually the chronic destruction of articular cartilage and leading to actually the deranged arthritis and bony erosions and leading to pain problems and issues with the mobility. As you know, the knee joint is actually the main joint which bears weight, and it's important joint in our body when we are talking about mobility, walking and gait. Therefore, any arthritis, whether it's rheumatoid or it's osteoarthritis, it's actually the limiting a person's life. And the problem with these two is that life for patient really becomes a lot miserable with severe arthritis of the knee joint, and it's cumbersome for the patient to actually carry out his or her activities of daily living. Even simple things like getting up from the chair and going to the bathroom, because sometimes these have their so much pain, swelling and stiffness over there that they cannot even just simply get up from their chair or bed and simply go to the bathroom. So you can very well imagine, if a patient is having this kind of a discomfort in his or her life, how miserable that life would be because of simply these two arthritis of the knee joint. And we will be discussing all that in detail today.